A 4-month-old girl presents to her pediatrician with a history of noisy breathing since birth and frequent respiratory infections. She has also had difficulty feeding, with frequent spitting up or vomiting. Stridor is noted on physical examination. Bronchoscopy reveals the presence of complete tracheal rings and tracheal stenosis. Barium swallow reveals an anterior filling defect in the esophagus. Which of the following is most consistent with these findings? Option A, double aortic arch. Option B, right aortic arch. Option C, pulmonary artery sling. Option D, tracheoesophageal fistula. Option E, mediastinal mass. Take 10 seconds. Complete tracheal rings causing tracheal stenosis. That is a very specific finding. Stridor and feeding difficulty since birth. And the barium swallow shows an anterior filling defect in the esophagus. Which vascular anomaly is the only one known to cause anterior esophageal compression? The correct answer is C, pulmonary artery sling. Pulmonary artery sling is a congenital vascular anomaly in which the left pulmonary artery arises from the right pulmonary artery instead of the main pulmonary artery. It then passes posteriorly between the distal trachea and the esophagus, compressing both structures. This causes respiratory symptoms including stridor, tachypnea, cough, and frequent respiratory infections, as well as esophageal symptoms such as feeding difficulty, dysphagia, and vomiting. A critically important fact: pulmonary artery sling is the only vascular ring or sling that causes an anterior indentation of the esophagus on barium swallow. All other vascular rings, including double aortic arch, right aortic arch with aberrant left subclavian, and others, cause a posterior esophageal indentation. Additionally, many patients with pulmonary artery sling have complete cartilaginous tracheal rings, which are normally C-shaped, resulting in tracheal stenosis. The findings seen on bronchoscopy here. Double aortic arch is the most common vascular ring and causes a posterior esophageal indentation, not anterior. Tracheoesophageal fistula causes feeding difficulties and recurrent pneumonia, but would not cause complete tracheal rings or tracheal stenosis. A right aortic arch also causes posterior esophageal compression. A mediastinal mass could compress the trachea but would not produce this specific combination of complete tracheal rings and anterior esophageal defect. Key testing point: pulmonary artery sling presents with stridor and respiratory symptoms from birth. Complete tracheal rings with tracheal stenosis on bronchoscopy, and an anterior filling defect on barium swallow. It is the only vascular anomaly that causes anterior esophageal compression. All others cause posterior compression. Diagnosis is confirmed by CT or MR angiography. Follow for daily board questions.